Hi there, my name is Dre. I'm the host and founder of the Dragon Network, a membership-based community where health IT professionals can collaborate with one another and share ideas and experiences relating to the world of healthcare technology. On today's video, I want to dive a little bit into the topic of patient consent for data exchange. So I will likely do another video on this topic in the future, but I want to just touch the surface for now so we can really understand what the three different high-level models for patient data exchange consent are. So when we're talking about consent to exchange data, I am not talking about the data exchange that occurs when someone is in a situation where imminent care is required. So if you present to an emergency department, to an urgent care, or in a critical situation, and the care providers need to access information about you so that they can understand your history to better treat you, I'm not talking about the data exchange in that particular instance. What I'm talking about is the data exchange that would occur to have a generalized query sent to an HIE, perhaps to have your information included in research studies, situations where the information is not needed to deliver imminent care. There are three high-level frameworks for consent, and those three frameworks are no consent, opt-in consent, and opt-out consent. So we'll talk a little bit about what each one of those means. So first up, we'll deal with no consent. So no consent is very straightforward, very simplistic, and just means your data is automatically available to the systems that will allow for exchange with other organizations or entities. So consent from the patient is not something that is sought or something that is required. So this exchange model, as you can imagine, comes with a fairly high number of risks. So I don't believe there's a lot of organizations that follow this type of model. I haven't actually come across any in my experience working in health IT. However, the model does exist, and when we look at a global environment, I do believe that there are certainly places that would have a no consent type of policy. So the next one we'll talk about is opt-in consent. So with an opt-in model, data cannot be shared across any entities or between any exchange partners unless the patient opts in to have their data shared. So there has to be an active and explicit action where the patient indicates, yes, my data should be shared, and it should be shared across the network. So with the opt-in model, there are several different layers that can be applied, and these can be applied differently depending on the organization that's maintaining the data, as well as the state where the legislation was written or the country where the legislation was written. So if we're looking at the US, an example of an opt-in state would be New York. So no data can be exchanged between entities until the patient actively consents to have their data included and exchanged. So the different layers of opt-in consent are to allow for information to be available only to some individuals or to some entities. So the patient in this situation would identify specifically which organizations or which providers would be able to access the data or would be able to receive the data if it was pushed out to them. Another approach to the opt-in model is for patients to identify certain types of information that can be exchanged and to exclude others. So for example, a patient may indicate they want their encounter data shared and perhaps some categories of their lab data, but they can restrict their clinical documentation from being shared. So another layer to this opt-in consent could have the patient indicate that only certain data elements or data categories could be shared. So for example, with this one, they could indicate that they're okay with having all of their encounter information shared with the exception of mental health visits, or all their lab data shared with the exception of HIV status, for example. The final choice with opt-in is, of course, to have the patient agree to make all information available to be exchanged with any entity that is participating. So the final model for consideration is an opt-out model. So with this particular model, all of the information, or some fairly broad categories of information, are included within a data exchange platform unless the patient explicitly states that they do not want their data to be included. With this type of model, it's important that patients are given a reasonable opportunity to opt out. So communicating that their information is going to be included, but they do have the choice to opt out, is something that is very important and something many organizations struggle with as they try to determine where the best place to house that information is. So you'll find with some hospitals, for example, the opt-out information is included on their admission consent form. You'll have other entities that will have information packages that explain how data is utilized, and how it can be beneficial to the patient's healthcare journey, and that they again have the choice to opt out, and if there's an opt-out, how they would accomplish that. Similar to the opt-in model, the opt-out model also has many different layers to it. Depending on the organization or depending on the policies and legislative rule that govern the opt-out model, you'll see different layers of this occur in different places. So with an opt-out model, some of the choices that are available to patients may be that their data can be included and can be exchanged, but only for specific purposes. For example, they're okay if their data is exchanged with other entities for the purpose of providing care, but they would prefer to opt out of having their data included for general research purposes. There may also be instances where patients agree to have their data included, but opt out of sharing it with certain entities. So if there's a particular participant in the exchange that they do not wish to share data with, for example, a payment entity, then some opt-out models will have the ability for them to opt out of that. You can also, of course, have the option of allowing your data to be shared, but opting out of having certain data types or data elements shared. So some opt-out models are set up so that individuals can opt out of having, for example, mental health data shared. All opt-out consent models will have the option for the individual to fully opt out from the exchange, to say that they do not want their data to be included in any capacity in a health information exchange. And again, as I mentioned at the very beginning, we are not talking about the exchange of data for the imminent delivery of care. We're talking about non-imminent, non-urgent data exchange. So looking at the US, Arizona and Kansas would be examples of states who have opt-out policies. There also happens to be some combination type states. So if we look at Connecticut, for example, they have an opt-out policy for general information. So again, meaning all of your information is going to be included unless you as a patient opt out of that. But for sensitive patient information, so some of your mental health data, some of your specific lab tests, some particular surgeries, things like that, they actually have an opt-in policy. So you can have a state that has both. And again, it depends on the legislation of where you're at. So as a health IT professional, one of the most important things to recognize about health data exchange consent is that there is not a universal practice. And within a geographic area, there's also often some differences between different entities or organizations. So if you're someone that's consulting, it's very important if you're working on an HIE type project or a project that involves health information exchange for you to understand what the policies and the legislation are for the organization that you're working with before you dive into the solutions for a particular project or before you start working on something. So don't forget, things also change all the time. So just a good rule of thumb is everywhere you go, if you're working on health data exchange, check the policies first, check to see if there's any pending legislation, and find out what the rules are. So thanks for joining me. And again, if you haven't hit that subscribe button yet, go ahead and do so and turn on the notifications so YouTube will tell you when the next video is out. And as always, if you're interested in joining the Dragon Network for some deeper dives on some of these topics and general conversations with other healthcare professionals, head to network.dragon.com and sign up for your free trial. See you next time.